The next skill we're going to perform is complete or partial bed bath. First is you need to introduce yourself and identify the patient using at least two identifiers. Hi ma'am, I'm Hardy Gama Jr. I'm a student nurse and you are, and what is your birth date? The next is you need to perform hand hygiene. So after performing hygiene, next is you need to assess the environment for safety, and also you need to provide client privacy. So by closing the door and by closing the curtain. Then after that, you need to assess the patient's for risk status if batting out of bed or self bath was to be performed. And also you need to assess the patient's tolerance for batting. Then next, you need to assess the patient's cognitive and functional status. And also you need to observe patient's response if dementia is suspected. Next is you need to assess patient's visual status, ability to sit without support, and hand grabs and ROM of extremities. And also you need to assess for presence of position of external medical equipment. Then next, you need also to assess the patient's bathing preferences. Then after that, you need to ask if patient had noticed any problems related to condition of his skin and genitalia. The next is you need also to assess conditions of his skin before or during the bathing. Also noted the presence of the dryness or excessive moisture. The next, you need also to identify risk for skin impairment. And also you need to assess the patient's comfort using a pain scale. Next, you need also to assess patient's knowledge and perception of skin hygiene. And also you need to review orders for specific precautions, and also the concerning patient's movements or position. Then also to confirm with patient allergies to bath products. And also in planning, you need to identify the expected outcomes. Then next, you need to explain the procedure. So you need to ask patient for a suggestion on how to prepare supplies and how much of bath patient wishes to complete. And also you need to adjust the room temperature and ventilation provided privacy. The next, you need also to prepare the equipment and place the supplies on the beside the table. So you need to ensure cold light. So ensure cold light is within reach. So and bed is low and lock if it is necessary to the room. Then next is implementation. So implementation, first you need to offer patient a bedpan or urinal. Then you need to apply clean gloves as needed. Then you need to provide towel and moist washcloth. So first you need to perform hand hygiene. After performing hygiene, you need to apply the clean gloves. After apply clean gloves, next is you need to raise the bed to working height. So you need to lower the side rail, and also you need to assist patient to appropriate position. Then after that is you need to place the bath blanket over the patient. So you need to remove the sheet. So while patient held blanket, then place the soiled linen in a laundry bag. Then place in the laundry bag. Then after that is, next is you need to remove the patient's gowns or pajamas. So let's just think the patient have a pajamas or gown. Then next is you need to unmap the sleeves to remove gown. So you need to begin removal on the unaffected side if So if an extremity was injured, so then after that you need to remove gum properly if patient had IV line. So and IV line, and also you need to and the gown has no snaps. Then next you need to raise the side rail, so position bed to appropriate height. So while filling the basin with warm water. So the basin is have a warm water. Then also you need to position the basin and supplies so on over the bed table, and head patient check water temperature. Then, after check the temperature, you need to lower the side rail. So you need to lower the side rail, then remove the pillow. So remove the pillow. Then, after you remove the pillow, next is you need, if allowed, so you need to raise the head of bed appropriately. So you need to place the towel under the patient's head and over the chest. Then after that, you need to wash the face of the patient. So you need to ask if patient was wearing contact lenses. So you need to remove if appropriate. So you need to form meat with a washcloth. So immerse in water and wrung out thoroughly. So then you need to wash patient's eyes properly. So use clean areas of cloth for each eye. So you need to clean. And after that, you need to dry the eyes of the patient. Then after that, you need to soak the crust on eyelids. Then before attempting removal the dried eyes, then you need to ask patient if preferred soap on face wash the rinse and dried face and neck. And also you need to make patient if he wanted to be shaved. So next you need to rinse the towel. First you need to rinse the towel. Then after that